This is a 48-year-old man who developed shortness of breath and cough 3 months back. And as the shortness of breath progressed, he was admitted to Nagar hospital, where a pulmonary angiography was done and it was found to have multiple filling defects in the pulmonary arteries. So a diagnosis of pulmonary embolism was made, and he was there in the ICU, and after some time he was discharged. And he had been more or less okay, but at the same time he also had a loin pain. And then they found out that he was having a renal stone. They thought of pyelonephritis. There was some inflammation, maybe fever, and he was treated with antibiotics, and that also went parallelly with this. Now he has come to us today with pedal edema since the last 1 week. So once we evaluated him, we thought we'd like to see his heart to rule out any left ventricular problems as well. And look what we found. We find that his left ventricle is not moving well. It definitely has a systolic failure. The ejection fraction looks to be around 35%, not more than 35%. And of course he's got left ventricular hypertrophy, he's got a dilated aortic root and fairly well dilated left atrium, all suggestive of a left ventricular end diastolic pressure rise, and essentially most likely a coronary artery disease, because we can see that the left ventricular interventricular septum is also not moving properly in comparison with the posterior wall. So that is the parasternal long axis view, and now we just make it short axis, and you can see the left ventricle is dilated, and you can see both the right ventricle and left ventricle here. Now you come to the fourth chamber. So yeah, fourth chamber is also giving us similar vibes. You can see the right ventricle here with the trabecular, the moderator band, and the right atrium, left ventricle. Yeah, I think that's all more or less. That's the aorta, pulmonary artery, and that's it. Okay, let's close.